Good evening. Today we have a pleasure of having a conversation with Victoria Rivera. Victoria Rivera is a wellness psychotherapist in New York City. She has a corporate wellness practice. Victoria attended Colgate University and earned her bachelor's degree in liberal arts, majoring in religion and psychology. Then she graduated from Columbia University School of Social Work. She is practicing in New York City, and she constantly increased her level of education. She completed NYU Institute of Psychoanalytic Education, Adult Psychodynamic Psychotherapy Program, certification in mindfulness based on stress reduction, and the Institute of Integrative Nutrition Health Coaching Certification Program. Victoria has a private practice since 2014, and she incorporating all her knowledge and experience to providing holistically oriented treatment to New Yorkers who are type 8 personalities with high functioning anxiety, who struggle with the self-care and finding meaning in their lives. I really like that aspect of the self-care because we're going to talk a lot about sleep, which is the most important aspect of self-care. Victoria has expanded her work to corporate America and providing wellness workshops and meditation training to companies in New York City. And she participates in a major organization. She worked with Ballet Hispanico, PayPal, Wellness, and a lot of other respectful corporations. It's very nice having you today, Victoria. A lot of my patients are concerned about good sleep. And also, thank you very much to all our listeners. We would like to know who you are. Please put your name in the chat box. We would like to acknowledge that. And please put your questions to Victoria regarding good night's sleep and some other topics what you find interest about. And I would like to start our conversation with a story about us, how we met. We met at a sleep workshop, and that linkage actually was strengthened by our conversation about this book, Breath. We both find it fascinating and interesting for our professional practices, and from that actually it leads to this. And Victoria, I would like to know your story. What made you to become a wellness psychotherapist, and what specifically appealed to you in this area of medicine?
Thank you. First of all, thank you so much for having me. It's a pleasure. We've had so many great conversations, not just around sleep, but around mental health and how people are needing to take care of themselves and how challenging it is, and how important both of our work
Recording in progress.
In terms of helping people. So I think how I started was I started as a social worker doing clinical psychotherapy with patients in different situations. Sometimes people would have just a breakup and then they were going through that, or they had schizophrenia or bipolar disorder. So a very wide range of people. But what I noticed with everybody is that diet, exercise, sleep was often impacted by their mental health, or their mental health was impacted by their inability or difficulty with what they were eating, or if they were exercising or not, and most importantly, like sleep. So that's how I got interested in all of aspects of wellness, because we're not just our mind, we are our body, and we're interconnected. And so it's so important to look at all of those aspects, especially when you're trying to treat somebody for a mental health issue. It's often physical as well.
It's such an important point you mentioned, like whatever primary, what secondary, and it doesn't even matter. You really want to do it well on both ends.
Yes, and I didn't know a lot about nutrition. You don't get taught that in social work school or even medical school much. You don't get taught about sleep You don't get taught about like exercise and how important that is. Like there's so many things that we were not taught. So you kind of have to go and seek out all of that. Mindfulness meditation, like all of these tools and things that are out there that really help both our physical and mental health.
That's so interesting, and we would like to know more. Please put your name in the chat box and please put your questions. We would be very honored to answer either during our live discussion, or I can forward those questions to Victoria to answer afterwards. And my question to you regarding your practice: what's the most common problem you help people with in your professional life, in your
I love this.
routine?
Yes, I love this question, and it's going to maybe surprise people, but maybe not. Relationships is the number one thing that comes up. So no matter what, if somebody's telling me that they're anxious, depressed, upset about something, it always comes down to relationships. Now, sometimes it's the relationship with just themselves, where they're not taking care of and honoring what their body and their minds need. And so then they're experiencing these symptoms of depression and of anxiety, of feeling stressed, of feeling overwhelmed. And so we work on the relationship that they have with themselves, relationships that they have with other people in the environment, and how to kind of just help them understand how it all is intertwined. And that is like part of the reason why the anxiety, which is I think probably the second thing that people kind of come to me with, is anxiety. But again, it goes also back to that relationship that you have with yourself.
No, I think it's such an important topic you bring up, like relationship with yourself. Before you build relationship with somebody else, you want to make sure your relationship with yourself are healthy. And,
Yeah.
I think, just like you mentioned, physical well-being, it's so important. It's really hard, I don't know, maybe it's from my philosophical point of view, it's really hard to bring your luggage into relationship with somebody else. I think you have to have a very clear understanding, and I like how you mentioned that topic. And I think, if you feel good and calm and with your help, I think it's very important. And going back to my practice, a lot of people complain on that part of relationship which goes to unsatisfactory sleep. That's very difficult part of relationship with ourselves, because sometimes sleep we cannot control, and different questions come up. Sometimes it's difficult to fall asleep. Sometimes it's difficult to stay asleep. And as unpleasant as it can be, to feel unrefreshed in the morning. Like, for example, I met somebody today, and this person, he got so attached to sleep medications. He doesn't feel he can fall asleep without it. And it's sad, because sleep medications, they have a side effects, and there are a lot of things what I can say about that. And please talk a little bit more what you do for people who come with that part of relationship.
Yes. Well, first, I have to say, no matter what, like sleep is the foundation of everything, both physical and mental health. And the issue is that when we don't have good sleep, it impacts us on so many different levels. And so to kind of start off with like, okay, what should you be thinking about when you're trying to have a good sleep routine? The most important thing really is understanding that a lot of the things that we are exposed to today as humans are not natural and impact us in a very profound level, to the point of looking at screens at night. Our eyes are not meant to do that. We're meant to kind of go with the sun and the moon and fire maybe, but having like lights, artificial lights, screens, all of those things actually really impact us. And sometimes it doesn't feel like it does because it's not conscious, but it's unconscious. And I always talk about like how our eyes are the most important thing in our lives, and even people who are blind can find the circadian rhythms. Each cell that we have has a circadian rhythm around sleep. So getting your sleep together is the most important thing, and it's elusive to a lot of people for many different reasons, and we can talk a little bit about why. But you wanted to say something?
Yes, no, I really would like you to expand a little bit on circadian rhythm. I find it, it's absolutely true. In my conversations with the patient, I try to talk about biological clock, and
Yes.
I find it 100%. If you can, give us a little bit more of your professional advice on that,
Okay.
something useful, what people can train themselves, something what, would be right there, but
Sure.
to promote a
Yeah.
good sleep.
Totally, totally. Okay, but just we're in the context of being a human being. We're 200,000 years old. And older than that, based on evolution and how our bodies have connected and co-regulated with the environment, and co-regulated with the sun and the moon and the stars. And we don't even have all of the information on how, what happens to our bodies, but we do know that that's evolution, and we've been experiencing that rhythm for forever. And so we can't really go against that, but we are kind of going against it. And that's the big issue. And I think that's the biggest issue as to why people are having sleep problems. One of the best things that you could do is, and this is science, this is not me making it up. I follow this guy called Andrew Huberman, and he does a lot of work on sleep and our eyes and the stress mechanism, but is looking at early morning sunlight. Going outside for 10-15 minutes helps to set your circadian rhythms so that your body releases the cortisol, which kind of gets your body up and ready for the day, to the evening time, which sets the melatonin, which is the hormone that gets your body to go to sleep. And all of your cells recognize those. And so it's so important to kind of get into the habit of doing that. If you're having difficulty sleeping, that would be the first thing to start doing.
I absolutely love what you said. And I want to kind of repeat it because I think it's so valuable for my patients. Like, I really feel what night is night. Night, it means dark, means no light. No light from the cell phone, no light from the screen. And if you want to have some kind of, lullaby, maybe through the ears, but no light, like you mentioned about the eyes, and we live without awareness. What actually happened? We don't know. We think nothing happened, but our body registers a lot of stimulus. And I absolutely love what you mentioned about the sunlight, because morning it's so hard. We do coffee or whatever, but to get into the light, I think it helps so many people. Towards the that morning routine will help towards the evening. And again, that evening routine helps through morning. But I absolutely love what you said, and I think a lot of my patients would appreciate that advice. But I have some questions from my audience. And this is a very, fashionable topic called sleep diet.
Yes.
What can you say? It has a scientific name, and absolutely, you're welcome to use the scientific name, but I like, simple term. What's your situation with the technique, and what do you think about sleep diet in a modern world?
Okay, so sleep diet, the way I see it is like a cognitive behavioral kind of therapy around how do you kind of set yourself up to get your brain and your body to sleep the way that it should. And sometimes, I was just working with somebody recently, and they had just like a horrible thing happen, and their sleep is totally off. They were going to bed like at 5 o'clock, 6 o'clock at night, right after work, because they were so tired, and then waking up at 11, and then from 11 to 4 playing video games, getting all that light, and then falling back to sleep for a couple of more hours, and then going back to work. And this was a cycle that they were doing for about 3 or 4 days. Maybe it was a week. And what I had to do was get them on this sleep diet, which is really kind of like this routine of, okay, before you want to go to sleep at 5 and 6 because you feel exhausted and overwhelmed and tired. Let's figure out something that you can do that like elongates that time between you going to sleep, so that way you don't wake up at 11 o'clock at night and stay up for hours and then go back to bed, because that's not a healthy way of sleeping. Because actually there's lots of research, and we don't have to really go into it, but having like light between like 11 and 4 o'clock in the morning is really detrimental to your body, because your body is not, it's supposed to be in a healing, recovering mode and sleeping during that time. And in Chinese medicine, actually, they have certain times and hours that your body is actually healing. So your liver may be healing like at 11, 12 o'clock at night, your heart at this time. And look, who knows if that's true, but we do know that sleep is for rest and restoring and healing and rejuvenating. And when we don't like have a consistent night of sleep, that does impact our well-being and our health.
No, 100%. I usually talk to my patients to get to bed before the middle of the night, because they get, slow wave sleep, and after the middle of the night, they get the REM sleep. And, and of course, we're only touching, even with our conversation, we're only touching tip of the iceberg. There are so many unknown things, but this is absolutely the fact. It's a little bit challenging for people who have a shift work, but I think with the help of specialists like you, that can be also adjusted to the best of their ability to kind of follow the natural, pathway of circadian rhythm, which I find very important. What can you say for people who have a shift work, like your patient, like somebody who come home in the morning after, for example, emergency room? And I have a lot of people like that in my practice. And of course, I appreciate all the listeners who listen to us live. And you're very welcome to put your questions for Victoria in the chat, but also people who gonna listen to us in the recording.
Yeah. Well,
What your advice for shift workers?
For shift work, well, first it's recognizing, is that the way that your body is? Can your body acclimate to that? Like for some people, they can sleep during the day and that actually feels good for them. Some people, in the later afternoon, it feels good for them. I think it's just trying to figure out what works best for you. Now, typically for most humans, there's just like, the sleep cycle at night, which is generally like 7 to 9 hours. And then there's kind of another little sleep cycle, which is a nap time that a lot of our ancestors have done, and some people still do it, between like 12 and 4 generally. You take like a maybe 30-minute nap, and that like kind of helps rejuvenate you in the afternoon. I honestly, I think it's like really figuring out for yourself what works for you, and then seeing how many hours of sleep that you do need. Most people need 7 to 9 hours of sleep. Most people are not getting it, or they're like sleep deprived, especially like Americans. I think it's like 30% of Americans are sleep deprived and not getting enough sleep. So I would start there, whether you're doing shift work or not, is like, are you getting the amount of sleep that you need to be getting, whether it's during the day or the evening or afternoon or however your work schedule is.
But it's very nice what you mentioned. Not one size fits all. It can be modification. It's not the end of the world. I want our listeners to know about that. What it can be modified, and you're still gonna get a healthy amount of sleep. And going back to sleep routine, a lot of my patients are complaining, even with the therapy we provide in our office, with oral appliance therapy, they still complaining they waking up in the middle of the night. And I was reading recently, just like you mentioned, it's okay, our ancestor had a nap. I was reading about 2 sleeps at night. People in the ancient time, in the Middle Age, and a lot of, recording about they sleep until 2, 3 a.m. and then did some business, maybe milk the cow, maybe did some intimate routine, or read, or pray, and then they fall back to sleep. Please give us your professional opinion about 2 stages of sleep at night. What do you think about that?
I think it's very interesting. And again, I think it goes back to the environment. And back in the Middle Ages and during that time, we were living very differently as humans. And so maybe that was a part of like how that worked. And it probably could work for people now. I think, again, it's really just trying to figure out what kind of works for you. But I just would say with the caveat is that, just because you can play video games in the middle of the night, like the person I was working, doesn't mean that you should, right? So if you're doing something that's more like relaxing or leisure, or having like the light on and kind of disturbing that part of like like I was saying earlier about what your brain and your body is doing to repair, I think could probably like negatively impact. But again, I think it's, people have to kind of figure out what works for them. And if that doesn't bother them, that's the whole thing. If it doesn't bother them to wake up in the middle of the night and then go back to sleep and they're able to do it, then
I think it's like kind of reverse engineering. The idea what I'm trying to implant in my patients is that no, that's okay. That's what your body wants you to do. Don't get stressed about that. Definitely don't get your phone. Don't get excited about things. But to have a preparation, like to have a strategic preparation, that's my idea about that. If you might wake up in the middle of the night, maybe you have an audiobook. Still, you don't put the light on and you don't play active video games, you don't watch horror movie, or you don't do anything what can set you off. But, if you know that happened, you drink some water, you use the bathroom, you maybe listen to the book and you'll be able to fall asleep. I think anxiety plays significant role. Oh, what's going to happen? I cannot fall asleep. Oh. I think, if we can kind of...
yeah.
There.
Yes, I definitely think that too. And it would be interesting. I wonder if that was going on in the Middle Ages too, where people were waking up and that's why the study said that, or that, that they were anxious. But I, in my own practice, I noticed the same thing. When people wake up in the middle of the night is because of anxiety, and it's because of thinking about, something that you did in middle school that you feel guilty about, and all of a sudden your brain is bringing it up. And I love your suggestion, because I do the same thing. I suggest it to my patients, and if I wake up at 2 or 3 o'clock in the morning, I do the same thing. I will put on a body scan meditation or yoga nidra or an audiobook and just like let it go. And then eventually, because what you want to do is you want to get your brain to stop thinking, because it'll keep on thinking over and over again about all the things that you did or didn't do, everything that's stressing you out. You want it to hook onto something, and hooking onto like a body scan or an audiobook gives it something to just kind of like relax.
Yes.
And to focus on without actually having to,
different perspective. I love it. Also, I know we talk about breathing. I know you a big
Yes.
Big proponent of breathing, and it brings us, actually we got a question from the audience, what's the name of the book? And I would like us to talk about our favorite book called Breath by James Nestor, which actually start our linkage, and we both find it fascinating. Please tell me what was for you, what you find fascinating about this book as a wellness psychotherapist.
Okay, so I found out about this book probably from like a podcast, and when you reconnected with me, you said, "Oh, Victoria, I want to share this book that I just read. It's so amazing," and I just read it too. And so it was Breathe. So it's really fun. It's really funny, by James Nestor. It's an amazing book. And really what I like most about it is that he goes into the historical like aspect of how, as humans, like evolutionary wise, what's shifted in our mouths, our tongues, how we're breathing through mostly our mouth now, as opposed to our nose. And so this is a really big issue, because in the book, he actually did his own study. Him and this another guy, they did a single two case studies where they plugged up their nose and just breathed through their mouth for what I think it was like 9 days, right?
I think it was a little bit longer than that, but I like how maybe 2 weeks, how they develop a lot of interesting things.
A lot of medical issues.
Right.
A lot, feeling much more anxious, much more overwhelmed.
High blood pressure.
High blood pressure. They had so many other medical issues that popped up from that. And then they did the same thing. They took out the stuff in their nose, and then they just breathed through their nose. And they noticed a dramatic difference in their blood pressure, in their anxiety, and their ability to manage stress. I mean, there were so many differences. So now, look, those are just two guys kind of doing the study. But what we know, and I know Dr. Sokolina and I have talked about this a million times, is that when we do breathe through our mouth, it does make us breathe with our chest and not necessarily our diaphragm. And a big part of anxiety for people who don't really know, anxiety is the physical manifestation of like your stress, your fight or flight system that's getting activated. And we can activate it in many different ways, and we can activate it through breathing. And oftentimes, if we're breathing through our mouth, just like you're running, like say you're, running exercise or running from a tiger, whatever it is, you're breathing through your mouth so that you can get the breaths in through your chest. And many of us are doing that on a regular basis, breathing through our mouths and not our nose, and then getting ourselves into this fight or flight, anxious, AKA stressed state all the time. And so a big part of the work that I do with patients is really helping them to understand that physical aspect, to go back to, how important that is in addressing these mental health issues like anxiety.
No, I love what you said, because it's basically what I try to teach my patients. And I want to say how much we appreciate our listeners who listen to us live. We appreciate Pilar, and thank you, Jill Wilkins, for watching, and thank you, Terry. And we appreciate all the comments. Please continue putting them in the chat box. And regarding nasal breathing and mouth breathing, it's one of my favorite topics. Can you please give me your explanation? Why do you find a lot of people breathing through the mouth right now? And it goes well with anxiety as well. And it's so common in New York, and that's why your practice is flourishing.
Yeah. Your body's just trying to get air in, and sometimes because we haven't utilized our nose as much, and a lot of people will have like a deviated septum or polyps and things blocking their nose, allergies and stuffed nose, you start to get into the habit of breathing through your mouth. And when you start doing that, then your body just uses the mouth breathing and doesn't use your nose, and then your nose starts to actually close up
even more.
Yeah. So yeah,
I like what you bring that awareness and explain to your patients about nose breathing and relaxation and mouth breathing and anxiety, because it's so true, and I see the practical proof of it every day in my practice. But now I would like to talk about different topic. Additional to being such a brilliant practitioner, Victoria is successful graduate of our Myofunctional therapy program. And I would like you to share that experience with our alive and not alive, and with people who are going to listen on a recording. Please share your experience.
Okay, well, so listen, I don't like to suffer just like anybody else, and I have been grinding my teeth for, I don't even know, 10, 20 years. When I went to the dentist told me that I was too stressed out and I needed to manage my stress. I talked to my therapist about it, and she said I had unresolved rage that I had to deal with. And I'm like, okay, that all makes sense. Sure, I'm stressed. I have this rage that's unconscious. What do I do about it? The only thing I could do about it was wear a mouth guard. Because no matter what, you're sleeping and it's unconscious and you have no control over what's happening. I was so frustrated. In this book, Breathe, a big part of what James Nestor talks about, he talks about how our mouths have shifted and changed over evolution. And a big part of what's happened is because we've been eating processed foods, softer foods over the last several hundred years, our jaws and our mouths are smaller, so our palates are smaller, but our tongue is still the same. And you can correct me if I'm wrong. And so the work that I did with you was really figuring out how to build strength in my tongue, to hold up my upper palate, to expand this palate so that I would be able to have enough room so that my teeth weren't misaligned and grinding, and it worked.
I'm so pleased to hear that. That's really nice. you know, what we work on a lot, it's like a three-leg stool. But you have a joint, and then you have a tongue in the middle. And if you don't have a tongue in the middle supporting the joint, then stool become wobbly, and then people start grinding. And of course, a lot of temporomandibular joint disorders and pain in the jaw joints related to breathing problems. And most 99% of my sleep apnea patients have that. You know, they grind their teeth when they cannot breathe. They clench and move the jaw forward to open the airway. And I'm so pleased with that you don't grind, and you resolve that problem. It's wonderful to talk about stress, and I know a lot of dentists do that. It's an anxiety, it's stress. It's like, basically, answer is we don't know, but we kind of know, and we know what to do about that. And you write about proper reception of the tongue and function of the tongue and position of the tongue, which is very difficult, impossible to do if you breathe with your mouth, because if you breathe in the mouth, you're gonna keep your tongue really low and keep the airway open, and then TMJ become bubbly. But now I want to ask you tricky question: how did you incorporate myofunctional therapy into your routine?
Well, it wasn't easy, I have to tell you. I had to practice taking the time, but look, at the end of the day, the teeth grounding was so upsetting for me, and I just wanted it to stop, because not everybody does it. And I'm like, well, why am I doing this, right? So doing the exercises, I think reminding myself of the why really helped me to kind of continue to do it. And I think also too, having the liners and expanding my palate all at the same time helped to remind me that this is what I'm doing this for a reason, to like change how my mouth is, and to ultimately help me sleep better, feel better, and not grind my teeth anymore. So you just remembering the why was really important, and then incorporating it into my morning and evening routine.
I really like how you put it. Oh, I'm sorry to interrupt you. Remembering why. I think that's the key point. Remembering why. I'm going to use it in my practice. And now you mentioned about our nutrition, what it changed so much over the centuries. I would like to ask you about your recommendation on a food which will promote good night's sleep.
Okay. So,
and maybe schedule.
Yeah, well, it's hard. I mean, for everybody, it's different. Everybody has like a different type of diet that they follow, and I don't want to like change that. If it works for you, then great. But what I will say are there are several minerals and nutrients that we're missing in our current diet, especially like in America. And I'll highlight the 3 that I think are really important for everybody to have. Omega-3, which you can find in fatty fish and nuts. And we were getting more of that back in the days. Now we're not getting as much, because it's just not in our food system as well. And plus we're having like a lot of oils that have omega-6, which impacts the omega-3s. Anyways, taking omega-3 is really important, and eating things that are rich in omega-3. That's my first suggestion. My second is vitamin D. Now you can definitely get that through the sun, but many people are vitamin D deficient. And so taking a supplement, I do cod liver oil, lemon flavor. It has omega-3, it has vitamin D, it has vitamin A and K, which help to absorb the vitamin D. And then the last suggestion I have around what nutrient you should have is magnesium. Now, you can go to the doctor and have them check to see what your levels are, but a lot of people are actually deficient in magnesium. And magnesium is a very relaxing, like mineral, helps to relax your muscles, so that you can get a better night's sleep. So those are the 3 things I would recommend. The thing I would want people to crowd out, and I always go back to like evolution, we didn't have access to sugar the way we have access to sugar now. And our brains, our bodies love it. There's actually 3 like different systems that want that sugar. That's how much we love sugar as humans. But we didn't have it. We had it in honey. We had it in berries or fruits, sugarcane in certain places. Now it's everywhere. So if you could crowd out sugar, that would be so helpful for you in terms of your sleep, because there's also some good research around sugar and how like at night it might be in your glucose levels like are spiking up and down, and that might be causing you to wake up. You might be thinking it's about your boss, but it's really that your blood glucose levels are like off. So that's what I would say. And then the last suggestion I have about, this is more of a kind of a diet recommendation, not diet recommendation, but a way of dieting, which is called it intermittent fasting, which has actually been really helpful in terms of helping you to kind of set have some control and understanding of when you're hungry, when you're not hungry. And if you have a history of eating disorder, then I wouldn't do it. I would talk to your practitioner about it. You see your physician. But if you don't, intermittent fasting has been shown to have really great results in improving sleep, focus, energy, attention, and then also helping you to eat within a certain time so that you don't end up overeating and eating lots of sugar and things that are not so great for you that will impact your sleep.
This is such a valuable advices, and I got a lot of new information for me. Thank you very much, Victoria. We're so honored to have you on our Facebook Live. And to conclude our conversation, I would like you to share, 3 basic tips on everyday sleep routine, how to sleep soundly and fall asleep easy.
Okay, so the first one, early morning light. I know we talked about that.
Yes.
Very good. Then the next one is in the evening time. If you're going to look at light, which you will, it's hard not to, make sure that it's at your eye level or below. Because when we look at overhead light, that actually stimulates different circuitry in our eyes that make us much more alert and release cortisol, which is a stress hormone. And what you want is to be more calm and more relaxed. So low lights are very, very important before you go to bed. If you do find yourself having trouble sleeping, listen to like an audiobook, or like I do a meditation. It's very helpful. It like gets your brain to just like kind of calm down. If you can't listen to a meditation, do a body scan. They have these things called body scans where you go through different parts of your body. You go to, you feel your right toe, you feel your left toe, those kinds of things. That's very helpful because it gives your brain something to pay attention to. And then routine, it's going to take time, especially if you've been having trouble with sleep for a long time. Just get yourself into a routine of that early morning sun, like a relaxation routine at night, and you'll be good to go, I think.
Well, thank you very much. It was so wonderful to have you here. I hope a lot of our listeners are going to get now sound sleep. That's what we're here for. And we really appreciate. If you want to get in touch with Victoria, I'm going to put her information in below our recording, and we're looking forward to see you back. Thank you very much.
Yes, I'd love to do it. Thank you. Thank you so much for doing this. It's very amazing.